Hello everyone. We are going to see one of the most important arterial anastomotic system of our body, and that is the circle of Willis. It is also known as the circulus arteriosus. Where it is located, what is its functional importance, how it is formed, and what are its branches. All these points we are going to discuss in this short segment of video. Before going into the proper topic, we should get oriented with this diagram. This is the inferior surface of the brain, or simply you can call it as the base of the brain. So this will be the inferior surface of the cerebrum, and this will be the inferior surface of cerebellum, and part of the cerebellum is removed over here to expose the inferior surface of cerebrum better. This will be the brainstem region. In addition to the neural structures, a group of arteries are also shown in this diagram. So here we can clearly see that this will be the vertebral arteries, right and left vertebral arteries. They join together to form the basilar artery. The basilar artery at its end terminate as the posterior cerebral arteries. Here you can see the cut end of the internal carotid artery, and this is the middle cerebral artery, which is a branch of the internal carotid. This one is the anterior cerebral artery, another branch of the internal carotid. Other than these two arteries, in the internal carotid have another mainly three branches in relation with this surface. They are the anterior choroidal artery and ophthalmic artery, also the posterior communicating artery, which is shown over here. The ophthalmic artery is not shown in this diagram. Now we will come to the proper topic. This is the interpedunculair fossa, which is located at the base of the brain, and this arterial circle is known as the circle of Willis. The circle of Willis is located at the interpedunculair fossa, as clearly visible from this diagram. If we become more specific, we can say this arterial circle is located in the interpeduncular cistern. What are these cisterns? Cisterns are nothing but the specified places in the subarachnoid space. Even though we call it as an arterial circle, it is actually not a circle. It is somewhat like a polygon. So the sides of the polygon are formed by different set of arteries, and these set of arteries are anteriorly by the anterior communicating artery, anterolaterally on both sides by the anterior cerebral artery, laterally by the internal carotid artery and a part of the middle cerebral artery on both sides, posterolaterally by the posterior communicating artery, and posteriorly by the posterior cerebral arteries, which is shown over here. So this is how the polygon is formed. Why it is so functionally important? Because it equalizes pressure between different systems. What are those different systems? They are the carotid system of arteries and the vertebrobasilar system of arteries. In addition, this circle of Willis serves to equalize the pressure on both sides, on the right side and the left side. That is why circle of Willis is very important to understand. Now we will come to the branches of the circle of Willis. It is not possible to describe the course and names of all the branches of the circle of Willis. So in this video we will be concentrating on its central branches. What do you mean by central branches? These central branches, which arises from this arterial circle, will penetrate the substance of the brain and is going to supply the structures located deep in the brain. In order to understand the branches better, we are going to take this arterial circle alone into another diagram. Here it is. This is the circle of Willis. The sides and boundaries of the circle are very well identified in this diagram. Now we will come to see the central branches. The central branches are shown as these minute branches over here. For better understanding, the central branches are divided into 6 groups. The anteromedian group, right and left anterolateral group, right and left posterolateral group, which is not shown clearly in this diagram, and a posteromedian group. Let's see one by one. The anteromedian group, it arises from the anterior cerebral arteries and the anterior communicating artery. These arteries penetrate the lamina terminalis to supply the anterior part of the hypothalamus. Next, we will come to see the right and left anterolateral group, or otherwise they are known as the striate branches. The striate branches are divided into a medial set and a lateral set. The medial set of the striate branches or medial striate arteries are the branches of middle cerebral artery, and very importantly, you can see another artery is coming from this region, that is this is the anterior cerebral artery, and this branch is a recurrent branch which will course along this direction and will join with the medial striate arteries. So this artery is known as the recurrent artery of Hübner. So the medial striate group is contributed by both the middle cerebral artery and by the anterior cerebral artery. This medial group of striate arteries will perforate the medial part of the anterior perforated substance, and they will supply part of the basal ganglia and internal capsule. Rest of the part of the basal ganglia and the internal capsule are supplied by the lateral striate arteries, and they are also known as lenticulostriate arteries. They ascend in the external capsule and they pass along the external surface of the lentiform nucleus, which is a part of the basal ganglia. One of the lateral striate artery, which is the longest one, is also known as the Charcot's artery of the cerebral hemorrhage. Next, we will see about the posteromedian branches. These posteromedian branches, as we can see, they arise from the posterior cerebral arteries and right and left posterior communicating arteries. They are arranged in a rostral and a caudal group. They are going to supply the thalamus, hypothalamus and hypophysis cerebri. Then the last group will be the right and left posterolateral group of central branches. They are also known as thalamo-geniculate arteries. They are branches of the posterior cerebral arteries. They supply most of the lateral and caudal part of the nuclear group of thalamus and also the geniculate bodies. That is all about in general about the central branches of the circle of Willis. So in case of circle of Willis, we will see two very important situations where it requires an applied importance. First one, the occlusion of the lenticulostriate artery. Occlusion of any artery will have symptoms, but the lenticulostriate artery occlusion requires special reference. The occlusion of the lenticulostriate artery results in loss of blood supply to the internal capsule, which causes contralateral spastic hemiplegia, also paralysis of the lower half of face and altered sensorium. The second type of problem that can occur to this system will be the aneurysms. Regarding circle of Willis, one of the artery that carries a high risk of aneurysm will be the Charcot's artery, which we have already mentioned, which was a part of the lateral striate artery, and they are known as Charcot-Bouchard aneurysms. They are the result of long-standing hypertension. Their rupture, the aneurysm's rupture, will cause severe cerebral hemorrhage, which will have multiple effects. So that was all in a nutshell about the circle of Willis. Thank you for your patient listening.